Good afternoon, everyone. I am Rachel Savasik-Luxton, the Director of Research and Training here for the Dibble Institute, and I am thrilled to welcome all of you to today's webinar, Sexual Cyberbullying and Healthy Romantic Relationships Activate Sexual and Reproductive Health Resources. We are honored and thrilled to have Drs. Rachel Rosenberg and Samuel Beckwith, as well as Carly Nalon here to present on this topic, and I'll introduce them in just a moment. But before I do, just a little bit of housekeeping items before we get started into the webinar. If you're having a hard time hearing the presentation, please go ahead and exit out of the webinar. You can try and log back in, or you can opt to call in on your phone, as that tends to solve most of the audio issues for the session. If there's anything else technically wrong, like I said, sign out and log back in. That usually resolves it when things don't work. We'd also like to just take a quick moment and have you locate the hand icon on your GoToWebinar control panel, just to see who all here is new to the Dibble webinar. So if you're new to us, please go ahead and take a moment to raise that virtual hand so we can take a look and see who's joining us for the first time. All right. I think the hands are still going up, but I'd say briefly, at least probably a third of the folks who are on today are new to us. So welcome to your first ever Dibble webinar. We're glad to have you on today's session and look forward to having you on more in the future. So just as an aside, we will be having you ask questions in the question box that you can locate in the control panel. We'll have about 10 to 15 minutes at the end of this session for Q&A. And just so everybody knows, there will be a recording of this session, including the slides available to you, and that'll be released about several days after the webinar, and the link will be sent to you. So, especially with new folks joining us for the first time, I'd like to go ahead and introduce you to the Dibble Institute and who we are. The first way to start is by telling you a little bit about Charlie and Helen Dibble, who are the founders of the Dibble Institute. So Charlie did a lot of work with youth during his retirement, and during that time, he saw a lot of them having difficulties around their relationships, or when the parents of the youth that he worked with were having difficulties with their relationships, and he would see how that would impact those youth. So he had the brilliant idea of translating research into teaching tools that then could be made widely available. So thanks to Charlie, the Dibble Institute was born. And while we're not a direct service provider, we do develop research-based practices and make them available to individuals and agencies and organizations like those of you who are here today, so that you can serve youth and do the really important work. So with that, what is the Dibble Institute now? We are a national independent nonprofit organization. We do have clients in all 50 states who are providing direct services. And last year, based on our very conservative estimates, we, or organizations that we work with, reached over 126,000 youth based on materials purchased. So we just want to take a moment to say that we're very grateful to all of you who are here and who are not here, maybe right now, but join us later in the recording, who are doing the important work with the young people. So thank you for that. So in addition to the number of youth reached, I want to talk a little bit about our mission, which is to help young people successfully navigate their intimate relationships through important information to help them build their knowledge around relationship building and skills-based practices. And we know that when we have these conversations with youth, that it pulls a lot of levers. So we're talking pregnancy prevention, dating violence prevention, the mental health lever, job readiness, and even more. So that's why, we really believe in the importance of this work. The other thing that guides the work we do are our values. And the first one that we want to highlight is that we're big believers in research, as you can see from the presenters that we have here today and from past webinars, and also our work that we do. All of our programs are research-based, and we continue to strive to have our programs evaluated at the highest level to demonstrate their impact and their effectiveness. So with that, it also means that updates are made to our programs as we learn new information. And we continue to, make sure that we're up to date with what's going on in the times. So another value that we believe in is safe, stable, and healthy or nurturing families of all different family formations. And our goal for young people is to be raised in these families. And lastly, what we believe is that relationship education is for everyone. All of us can improve our relationships, and we make sure that our programs are reflective of that in the scenarios, in the slides, and in the language that we use. So that's a little bit about the Dibble Institute. I hope you all will continue to come back, but I'm going to go ahead and do a quick introduction to our presenters because they are the reason that you're all here today. So the first one I am going to introduce is Dr. Rachel Rosenberg, who is a senior research scientist in Child Trends child welfare research area, who specializes in quantitative and qualitative research methods, engaging youth and other community members with lived experience in the research process, research to practice translation, and project management. Dr. Rosenberg's work focuses on the transition to adulthood for young people transitioning out of foster care, and she's currently the principal investigator for a data and evaluation partnership with the Family Wellbeing Strategy Group, Annie E. Casey Foundation, and a project director for the program evaluation of the Compassionate Education Program at the National Center for Youth Law, and a task lead for Activate. There are a lot of great things to say about Dr. Rosenberg. We also have Dr. Sam Beckwith, who is a research scientist in the youth development area of Child Trends. He's an adolescent health researcher with a decade of experience developing, conducting, and communicating about research on youth well-being. His primary research interests are adolescent sexual and reproductive health, gender norms, and positive youth development, as well as the way that these topics kind of build on one another. The end goal of his research is to build better understanding of the ways programs and policies can serve and empower young people, improve outcomes starting at a critical juncture in their lives, and reduce inequalities. Within Activate, he has worked to develop resources for youth supporting professionals on a range of topics, including summarizing sexual health outcomes for opportunity youth, understanding how workplace sexual harassment affects youth, and conceptualizing healthy romantic relationships. And last but certainly not least, we have Carly Nalon, who holds a Master of Public Policy from American University and a BS in Psychology with a concentration in mental health interventions. Carly is a senior researcher analyst in the child welfare research area at Child Trends, and their current work focuses on evaluations of programs and initiatives that support transition age youth in foster care. Their research interests also include policies and interventions that improve youth sexual and reproductive health outcomes, particularly youth in or exiting care. So that's a little bit about our presenters. I will go ahead and turn it over to them so that they can go from here.
Well, I want to say first, thank you, Rachel, for that excellent introduction. Thank you to the Dibble Institute for having us here today. We're extremely excited to be able to share some of our work with you and introduce Activate to you all. So, as Rachel said, I'm here with my colleagues, Rachel and Carly, representing the resources on sexual cyberbullying and healthy romantic relationships that Activate has recently put out. Next slide, please. So we do have 3 specific learning objectives for this webinar. We hope that after viewing this webinar, you'll be able to understand the different forms that sexual cyberbullying can take and how youth supporting professionals like yourselves can be resources for the young people who experience it. Number 2, that you'll be able to recognize the components of healthy relationships and understand some strategies for discussing healthy relationships with young people. And number 3, that you will identify healthy relationships from the helpful resources from the Activate Center on these topics, as well as recognize the Activate Center as a repository for resources on a variety of other topics relevant to your work. Next slide, please. So before diving into the details, I can start by just saying a little bit more about Activate, as well as the process that we follow to translate research into practice. So Activate, which Child Trends leads in partnership with Chapin Hall, Activate aims to bridge the gap between research and practice in support of the Office of Population Affairs' mission to prevent unintended teen pregnancy and to promote adolescent health. Activate creates research-based resources for use by use by professionals who support young people who experience the child welfare or juvenile justice systems, who experience homelessness, or who experience disconnection from school and work. And those young people are sometimes called opportunity youth. Activate focuses on translating research to develop resources primarily for professionals who support youth with those experiences. Next slide, please. So how does Activate achieve its mission of translating research into practice, or maybe stated somewhat differently, bridging research into action? We actually have a 5-step process for this, and that's depicted on this slide. And all of these steps are done in consultation with our Research Alliance, which is a group comprised of approximately 40 youth supporting professionals, young people with lived experience, as well as subject matter experts. So the Research Alliance provides significant input throughout the entire process, including on the topics that we examine, the framing and development, and the way we think about all these materials, and identifying next steps once we have developed a new resource. So where's the next set of questions that we're going to ask? Step 1 in this process is to identify the need and opportunity. So basically asking, what are the important topics where there's not much evidence-based but practice-oriented information available? So this step in particular involves a lot of listening to the Research Alliance and understanding what's on their mind. Step 2 is to collect and curate the available information. So we'll do this by doing a search to see what is known and what is maybe an open question on these topics. For some topics and issue, there's a lot more information than others, but we'll often find that even if an issue is considered high importance or something where there's been a lot of work already done, like healthy relationships, for example, the young people in Activate's 4 focal populations have not been considered or really even mentioned in many of the existing resources. Step 3 is to synthesize the available knowledge into a brief and accessible research summary. So this summary really helps ground our understanding of a topic, and it tees up our practice-oriented materials. Next, in step 4, we make research actionable, and we do this by applying the summarized research into a practice-oriented form. So for example, we've created things like frequently asked questions, discussion guides, infographics, one-pager fact sheets, and many more types of resources on these topics. And our last step is training. From our perspective, training means disseminating the practice-oriented materials through our networks, doing presentations such as this, and continuing to work with our Research Alliance to get the research to practice materials really in the hands of frontline professionals to help them build their capacity, as well as to give them just an easy evidence-based reference on a topic that's important to their work. I'll also note that this process really is cyclical and it's iterative. So we're always building off of our previous work and trying to stay at the forefront of developing issues. So next, I'm going to turn it over to Rachel to discuss our resources on sexual cyberbullying.
Thank you, Sam. As Sam mentioned, I am going to discuss 2 different resources around sexual cyberbullying. The first is a research synthesis, and the second is a technical assistance tool. Go to next slide. The research synthesis provides an overview of the available research related to sexual cyberbullying that we were able to find. This research synthesis is best used to orient new staff to sexual cyberbullying, what it is, what to look for, and some of the risk and protective factors. The technical assistance tool is a bit more hands-on and is a great tool when working with staff to recognize the signs of when a young person may be experiencing or engaging in sexual cyberbullying. Next slide. As Sam mentioned in the steps that Activate uses for research translation, one of the first steps is really identifying the need and the focus of a project. And so during a needs assessment that we conducted in 2023, sexual violence emerged as a priority topic. And our Research Alliance members helped then define the scope of sexual cyberbullying and what we were going to focus on. We looked for research on sexual violence among active-age populations broadly, and we found that there's a large amount of research focused on exposure to sexual violence as a precursor to child welfare involvement, including foster care entry, as well as children exposed to domestic or intimate partner violence in their homes. But there was less research around risk for sexual cyberbullying as young adults. And so we then looked at and found that exposure to sexual violence through social media and other technology, such as unwanted sharing of pictures or sexual harassment online, is a growing problem. And we found that there was a lack of research broadly, but really specifically with active-age populations. Next slide. So given that gap, we decided to focus our efforts there. And so based on feedback from the Research Alliance members, such as youth supporting professionals like yourselves, young people, as well as various policy experts, we decided to really hone in on technology facilitated sexual violence, or what we are calling sexual cyberbullying. Through our conversations with our Research Alliance, we uncovered that sexual cyberbullying is a common issue that young people face, although they may not label it as sexual cyberbullying. And so the language piece is really important here, and we'll talk about how that shows up a few different ways. Our RA members also noted that staff need more training and resources to better understand the nuances of sexual cyberbullying and the social media platforms where those behaviors can occur. Social media is quickly and ever changing, and so really trying to figure out what those commonalities are to watch for. Like I mentioned, there's often a disconnect in language. So youth tend to describe what they're experiencing rather than necessarily using a label such as sexual cyberbullying. And so really working with youth supporting professionals to be able to translate the description into the tangible label that they can then use to further the conversation with young people. And then the last thing we mentioned through the RA is that it's essential for staff to take the time to clearly explain what sexual cyberbullying entails, ensuring that youth have a thorough understanding of the behaviors involved. There's a lot of nuance and gray area here, and so what we heard from both young people as well as those working with young people is really that sometimes it's not super clear, and so really honing in on the nuance and the in-between can be helpful. And go to the next slide. We're now going to talk a little bit about what sexual cyberbullying is. So sexual cyberbullying is defined as any sexually aggressive or coercive behavior facilitated by electronic media. And it refers to a wide range of behaviors, but these actions are intended to harm, embarrass, threaten, or intimidate another person. The first behavior is sexual cyberbullying, which includes sextortion, where someone is coerced into providing sexual images or favors under threat. An example of sextortion could be receiving or sending a message claiming that an explicit image will be shared online unless one complies with the sender's request. Our next term is online sexual harassment, which involves sending unwelcome sexual messages or engaging in inappropriate behavior in digital spaces. And an example of this is receiving or sending an unsolicited message on Instagram asking about what someone likes or is into sexually. Next, we have non-consensual sexting, which occurs when private, explicit images or messages are shared without consent. And an example of this is receiving or sending a naked picture on Snapchat without consent. Next, we have revenge porn, which involves sharing intimate images or videos of someone to humiliate or harm them. This often occurs after a breakup. And an example of this would be distributing photographs or videos of an ex-partner obtained via hacking or other methods. Next, we have cyber stalking, which refers to persistent and unwanted monitoring, harassment, or threats online. And an example here is receiving or sending messages through a social media platform that one is being watched. Lastly, we have cyber dating abuse, which includes manipulative or abusive behaviors in online relationships, such as controlling someone's actions or sending harmful content. And an example here is finding hurtful comments about one's body on a partner's Instagram post. So I know that's a lot. All of these examples and definitions are included in both the research synthesis and TA tool for more information. On the next slide, we go into a little bit more about the information you can find in that research synthesis, which includes information on prevalence of each of the sexual cyberbullying behaviors that I just covered. For example, 46% of teens ages 13 to 17 reported experiencing one of the following cyberbullying acts: offensive name calling, being the subject of false rumors, receiving explicit images they didn't ask for, having images shared without their consent, physical threats, and/or persistent questioning. The research summary also goes further into definitions that we just presented, as well as those examples. Next, the summary talks about risk and protective factors, which we'll cover more in just a few slides. And then importantly, we discuss laws on sexual cyberbullying and why there's currently no federal legislation on the topic at the time of publication. And we highlight common state laws and encourage you and other professionals to familiarize yourselves with the laws in your own state, because they do vary. And like I said, as of now, there's not that large federal legislation piece. And then lastly, we provide a list of additional resources for youth supporting professionals wanting to learn more about the topic. Next slide. So it's important to understand where sexual cyberbullying may occur. Sexual cyberbullying can occur through technology, including emails, instant messages, text messages, and public post or direct messages on social media. Sexual cyberbullying has increased and does occur on different social media apps. We do recognize that social media is ever-changing and varies across communities and ages, which makes it difficult to completely track and fully understand the prevalence of sexual cyberbullying across platforms. For this reason, we do encourage youth supporting professionals to stay up to date on the latest social media and talk with youth about the platforms they're on, ways to protect themselves on those platforms, and the privacy rights they have. So really focusing on privacy settings within different apps, ways that you can report users when sexual cyberbullying is occurring, things of that nature. A few notable apps that did come up in our conversations with young people, as well as in the research, include Instagram, Discord, WhatsApp, and Snapchat. However, there are many more, as you can see on the screen here, and so that's why it's really important to understand this specific social media apps that young people that you work with are on. You can go to the next slide. There are many signs that a young person might be either experiencing or engaging in sexual cyberbullying. And as I mentioned earlier, the same young person may have both happen. So they often don't happen independently, and often young people are both experiencing and engaging in sexual cyberbullying. So for example, youth who are experiencing sexual cyberbullying are more likely to use social media, more often be bullied in person, and have higher levels of stress and suicidal ideation. And youth who engage in sexual cyberbullying often use drug and alcohol at a higher rate and have lower levels of self-control and self-esteem. We also know from the research that parental monitoring and peer support can help protect youth from experiencing and engaging in sexual cyberbullying. Slide. To help youth supporting professionals identify when sexual cyberbullying is occurring, we provide examples that use slang and emojis to emphasize cultural and contextual differences in communication. And these examples can all be found in the technical assistance tool that we will share a link to in the chat. So this slide shows different examples of youth experiencing sexual cyberbullying in each text box. So for example, one of the text box reads that a partner insists on looking through their text messages and doesn't believe them when they tell their partner they are not flirting with other people. And so the young person hasn't labeled this experience as sexual cyberbullying, but it could be one example to watch for to then open up a larger conversation. Next slide. Similarly, we have examples of what a young person may share who is engaging in sexual cyberbullying in each text box. So for example, a youth might share, I made a Finsta to DM a person I saw at school and ask for images. A Finsta is considered a fake Instagram account, and so here we've tried to use slang that we heard from young people. And it's important to pay attention to slang and emojis, as a young person may use them when talking to you about things they are experiencing. So they're not just used online, they often translate and are used in everyday conversation. When in doubt, we always encourage folks to ask what things mean. This was advice we received from young people, and I think is really helpful in not making assumptions or trying to kind of fill in the blanks. Next slide. Lastly, we provide recommendations for providers. So the first is to talk about online platforms and sexual cyberbullying with young people. The goal here is to not shy away from the topic and not shy away from the fact that we know youth are on these social media platforms. Next, learn about sexual cyberbullying laws within your state. As I mentioned, they do vary from state to state, and so it's really important to understand what is happening in your jurisdiction. Next, inform young people about how consent relates to online behavior. So it's really important, some of the examples we gave really emphasize that without consent piece. And so some behavior is always going to be considered either engaging or experiencing sexual cyberbullying, but some isn't, and that it could be consensual in different contexts depending on the consent given. Next is support young people who have experienced sexual cyberbullying. Then try to avoid using any type of judgmental language or seeming shocked. So really just trying to have open and honest conversations. And then lastly, connect youth with local services when additional resources or services might be needed outside of your role or capacity. At this point, we can go to the next slide, and I'm going to pass it to my colleague Carly to share more about our Healthy Romantic Relationships resources.
Hey everyone. So just as Rachel covered 2 of our publications on sexual cyberbullying, I'll be running through 2 of our publications on healthy romantic relationships. You can go to the next slide. So on the left side of the slide, we've included a screenshot of our research synthesis, which can be helpful when you'd like to learn more about healthy romantic relationships in a general sense, what they might look and what they might look like for youth. It'll help you get a better understanding of the systemic and the cultural factors that might influence romantic relationships, which I'll talk a little bit about in a bit, and to know more about what the research says about talking to young people about this topic. And then on the right, we have the cover page for our toolkit. And the toolkit can be helpful when you're first starting to work with a young person and when you plan to discuss relationships, or if you want to know more about the foundational work that it's helpful to do before having those discussions. Conversations about romantic relationships, whether healthy or unhealthy, they can be difficult and uncomfortable at times. So the pre-work can be just as important as the discussions themselves. And lastly, it might be helpful when you want specific examples of what to say and what not to say when you're talking to a young person. Next slide. So for these 2 resources, we follow the same research translation process that Sam walked through earlier and Rachel applied to the sexual cyberbullying resources. So our first step was to identify the need around this topic. And that helps us to contextualize the information and ensure it's really relevant to the field. And these are our takeaways from that process. So first, we know that activates focused populations experience an increased risk of unhealthy relationships, and that's well established in the research. But like Sam explained earlier, sometimes in these, in the research or these existing resources, these populations aren't mentioned. And so we found that most existing resources we identified through a resource scan focused on how to identify and prevent an unhealthy relationship, but very few focused on building healthy relationships. This was especially noteworthy for us because at Activate, we try to approach the work from a strengths-based perspective rather than the opposite. Overall, we found a lack of information on how to form healthy relationships. And finally, there were very few resources for professionals that give tips on how to work directly with youth. As you can imagine, a resource on healthy relationships can include any number of things, and it's absolutely not possible to cover everything. So from there, we went back to the Research Alliance, and the youth supporting professionals and the program administrators that we work with, they helped us narrow in on the components of healthy relationships that we will ultimately focus on. And those are communication, boundaries, and limits, and shared power. Next slide. The Research Alliance also highlighted the importance of addressing cultural and systemic differences in healthy relationships. So for example, cultural norms about communication style might differ. In some cultures, people rely heavily on nonverbal communication, and that might be body language, eye contact, physical proximity, tone of voice. And then in other cultures, people rely mostly on verbal cues and focus less on the nonverbals. This piece of information is important because differences in norms can lead to miscommunications quite easily in a relationship when partners aren't aware of what the others are used to. And systemic differences might also arise when partners are discussing roles within a relationship. So for example, partners might have different expectations about traditional gender roles or negotiating those roles. Lastly, the Research Alliance spoke to the importance of providing youth supporting professionals with tangible tips for implementing the information we found. And this piece is the central focus of the TA tool that was released a little bit ago in December, and we'll discuss that shortly. Next slide. So as I mentioned, the Healthy Relationships resource covers 3 main components, and this is how we defined each of them based on the information we digested in our research scan. So communication we refer to as allowing one person to share how they're feeling or what they think with their partner or partners. Boundaries and limits, which help youth express to their partner or partners what conditions they need to feel content and safe. And lastly, shared power, which we concluded requires a balance of support and responsibility between partners. Next slide. It's also important, it's easy to define these in really simple ways and boxes, but it's important to remember that there's significant overlap between these 3 components. And there are many, many other components that we didn't discuss in the research synthesis and toolkit simply because there are too many. And speaking to the overlap, though, the healthy communication is needed to set and enforce boundaries, for example. Setting boundaries can help partners understand how to share responsibility in a relationship and work toward equity. And lastly, partners must communicate effectively to establish balanced responsibilities once and so these 3 components do not exist in isolation. Next slide. So I mentioned nonverbal and verbal communication a little bit already. The resources on healthy relationships, both the research synthesis and the toolkit, have a focus on other systemic and cultural considerations because those can have a profound influence on relationships. There are also different views about autonomy, for example, and independence across relationships. Everybody's is different. This comes up when thinking about how much time partners expect or need or want to spend together. And I guess something else to note there is this consideration isn't just between partners, it also applies outwardly. So for instance, the importance of partners, friends, and families to themselves. Factors there might be the amount of time spent with their families and other friends and the types or amount of input that they have on the relationship. And then we also see societal biases influence the components of healthy relationships. A few that we came across and that might come up in conversations with youth are biases against LGBTQ people and how the pressures of society can be felt or experienced by partners, differences in gender role expectations, and also racism. Racism can impact a relationship both from pressure from outside the relationship and differences in life experience in interracial couples, for example. All of these considerations can be addressed, and the friction between them doesn't necessarily mean a relationship is unhealthy. Rather, it means, increased communication might be needed to ensure the partners are on the same page, and that they're each adjusting to their roles and expectations as needed. Next slide. So now shifting more into the tools in the toolkit. The first section of the toolkit is focused on laying the foundation for these conversations with young people, or what pre-work needs to be done before being able to talk about healthy or unhealthy relationships in a constructive way. Like I mentioned earlier, these conversations can be loaded and sensitive. And because of that, we've included practice tips. And they're listed here. Some of them include developing rapport and trust. This is one that I'm sure many, if not all of you, are familiar with. And having these in place can help ensure a young person feels heard and understood and supported. The second one we have listed here is creating a welcoming and private space. And that can help a young person feel comfortable talking about themselves and their relationship. This might mean reducing visual distractions or like auditory distractions in your office, maybe setting up a white noise machine. Or you might do this in a less physical way while you're planning logistics and mapping out sessions, building in opportunities for sessions to be youth-led if the young person is comfortable with that and into the idea. Next, we have preparing for, engaging in, and following up with youth with intentionality. This might mean planning and sharing agendas or topics for discussion ahead of time, and that way a young person can mentally and emotionally prepare. That said, you never know what the day might bring, and it's also important to maintain that flexibility and leave space to adjust as needed. If a young person is experiencing a crisis actively, talking about healthy relationships isn't going to de-escalate that. So yeah, maintain flexibility is important. It's also important to have self-awareness and to reflect on your own assumptions about healthy relationships. So what I was raised to believe or matured to believe doesn't apply everywhere or to everyone. In a very oversimplified way, this means just leaving your own emotions or biases at the door and engaging in professional development opportunities to continuously build those skills for those kinds of conversations. And then others we have here are maintaining your knowledge of state mandated reporting policies. They differ across states in some cases. And so pay attention to cultural norms and talk with youth about those differences. So they know what to expect in the conversations, what you might have to report to authorities or whatnot. And then lastly is to pay attention to cultural differences. And those are also important to discuss with youth. So I'm going to pass it back to Sam to give us an overview of 2 other tools we have in the Healthy Relationships Toolkit, and then to close us out.
Very much, Carly, for covering the Healthy Relationships resource, and we can move to the next slide. So yeah, to dive into part of our toolkit, one thing that we heard from youth supporting professionals was what they really wanted was tangible tips to just approach the conversations about healthy romantic relationships with young people and to get them started. That first step was one of the most difficult ones. So we worked with members of our Research Alliance to develop a series of prompts, and those include a getting started question, really an option for just starting the conversation, continuing discussion questions, and those can be used throughout the conversation to learn more, to connect with a young person, and to respond to the information that they're sharing. And then finally, a follow-up question, and that can be used to check in with the young person after the conversation. Like Harley said, it's about intentionality and also about follow-up and making sure it's not just a one-off. So this table on the slide just uses the communication component of the toolkit as an example. And I'll also note, and you may have noticed this already, that we have language of partner or partners here, because what we did want to create an inclusive resource and just remind those using this resource that some young people today may have different structures to their relationships than we might be used to. So we would expect someone using this resource to tailor the conversation to the specific person that they're talking to, get a sense of what their relationship kind of looks like. And during this presentation, I will probably alternate between saying partner and partners. But I wanted to highlight that we built that flexibility into the resource. So first, we have the getting started prompt, and that includes questions like, what does active listening look like to you? So just a way of starting up a conversation about communication. And then based on how the young person answers, we've provided several continuing discussion prompts, such as, how would you approach a discussion with your partners if you wanted them to listen to you more actively? Or another one is, have you and your partner discussed words or actions that signal that you're actively listening to one another? And so based on their responses to those questions, you can then discuss ways that the young person could incorporate practices about active listening into their relationship. And finally, we include a prompt for following up after the discussion, and that could be, how have you and your partner used active listening since we last spoke? So just checking on progress, checking on if it's still in their mind and part of their conceptualization of their relationship. Next slide. So on this, it's the same conversation starter and prompt structure, but this is for the boundaries or limits component of healthy relationships. And boundaries, of course, can include physical boundaries, material boundaries. Think about the boundaries you have around your personal belongings or your resources. It includes mental or intellectual boundaries about your deeply held beliefs, and emotional boundaries, especially about what somebody might be willing to share or open themselves up about. So the first getting started prompt here is, when you and or your partner set a boundary or limit, how do you show that you respect that limit? So thinking about getting them to think about a common practice in their relationship and if those limits are being respected. Then we have several continuing conversation prompts you might ask, like, what's an example of a boundary or limit that you set and your partner respected? So a reminder here that these on the screen are meant to provide examples or prompts. They probably won't cover an entire conversation. We'd expect you to engage with the responses there, but we wanted to provide options and directions for navigating conversations about boundaries or limits. And lastly, a follow-up prompt for checking in after the initial conversation is, since we last spoke, what boundaries have you set with your partners and how are those boundaries respected? Next slide, please. Conversation starters about shared power focus on input in the decision-making process, on the influence of societal pressures or biases, some of which Carly mentioned, and agreements about power sharing. The getting started prompt that we've included here is, what are some examples of the input you have or you want to have when making decisions? One continuing discussions prompt is, when you're having a conversation or making a decision with your partner, what kind of input do you want to have? And lastly, the follow-up prompt is, how has the input and decision-making with your partners been since we last spoke? So again, these prompts really serve to provide a helpful starting point for any of you who just want a bit of guidance in how to start conversations and keep them going regarding healthy relationships, or how to structure them. Next slide, please. Beyond the Conversation Starters tool, this toolkit also provides a resource on do's and don'ts for talking with youth about healthy romantic relationships. So this tool provides recommendations, and then for each recommendation, it has examples of what to do and what not to do. Broadly, it's important to approach conversations about healthy relationships with empathy, with a willingness to listen and learn, and a commitment to improve. So to do this, remember to keep an open and judgment-free zone, help young people explore their experiences rather than putting labels on them, to validate their feelings and their experiences, take a trauma-informed lens, especially if you've had the opportunity to have professional development or training on trauma-informed practices, and of course, to respect youth's privacy while being transparent and trustworthy about the limits to that transparency. And what you can hold confidential. So this tool really is meant to serve as another resource for navigating conversations about healthy relationships in an effective and youth-friendly way. So next, I think we're going to move into some questions and answers. We can probably move to our next slide to prompt those, and I will let Rachel from the Dibble Institute and my colleagues come back on to share those questions.
Thank you all so much. As questions are coming in, I just want to take a moment, obviously, to thank you for the presentation. And I was so excited to hear, the connection of healthy relationships and healthy relationship education, as it sounds like, a preventative measure for sexual cyberbullying is kind of what y'all were highlighting. And I appreciate kind of closing out on the do's and don'ts, because I think that can be really helpful too for people who are facilitating relationship education curricula or who are working with youth and they have this goal. So thank you all for the presentation. I will say one question that has come through probably 6 times already is, can we have the resources reference? And I have said that you all will be providing the link to the website. Do you want to shout out any specific resources or any links to highlight in particular?
I'm happy to drop the links to the specific resources, but I admit I'm not familiar with GoToWebinar. I'm seeing send chat to, it's a variety of organizers and presenters. I'm not sure how to send it to the whole audience, although Rachel, I could maybe send them to you.
I was gonna say, Sam, if you want to send them to Kim and I, we will make sure that those are included when we send out the information for the webinar.
Okay, yes, I'll get those links shared out.
Thank you, Sam. And I will just add, we'll put up a QR code, and I think it's the next slide maybe, that you can sign up for Activate's newsletter as well as follow us on LinkedIn. If you sign up for our newsletter, that's probably the quickest way to hear about when we release new resources. So always encourage folks to do that to stay up to date on any forthcoming resources. And then, like Sam said, we'll be sure to send out the existing resource links.
Perfect, fantastic. Yeah, that's what I've been telling people who have gone there. I'm like, there's the website at the end. You will have information at the end. But I think getting specific links can be helpful as well. So thank you all for that. And for those who are asking, yes, there will be a copy of the slides from the presentation when we provide the recording a couple of days after it has all been uploaded to the cloud and we've done everything that we need to do on our end. So I'm waiting for a couple of questions to come in, and while we do, I think it was really interesting, Rachel, how you were saying maybe the challenge with labeling kind of sexual cyberbullying and that youth don't really do that. I was wondering if we can talk maybe a little bit more about how to approach that conversation then with young people if they're not recognizing it maybe as what it is, and if we don't, have the language to connect, like what would be your advice?
It's a great question, and it's we posed a very similar question to the young people and the youth supporting professionals that we collaborated with from our research alliance on this, and a few things came up. The first I would say is that oftentimes a young person will know that it's not right or that something is off. They just won't know the exact language for it. And so in those cases, what we heard from RA members was that it was less about stopping and saying, oh, you're experiencing sextortion. Rather, it was more about recognizing the signs and then kind of helping the young person figure out what to do. So it may kind of, regardless of which type of sexual cyberbullying, it was really around, how do you report that account? How do you change your privacy settings so that you're not experiencing it? And then what resources does that young person need to address either experiencing or engaging in sexual cyberbullying to kind of address that immediate experience, as well as talk about what that might look like moving forward. The other component that we did here was that a young person may be describing something that doesn't immediately seem or make them uncomfortable. And so they may not necessarily recognize the behavior as from either the experiencing or engaging inside. They may not recognize that behavior as one that they shouldn't be either experiencing or engaging in. And we heard that approach is a little different, right? Because you certainly don't want to shame a young person or have a reaction that may make them closed off. And you also want to make sure that you all are exploring those experiences or behaviors and then kind of addressing them in the long run. And so for those interactions, we talked a lot about, again, that it's less about the label and it's more about building that trust and relationship with the young person to then kind of talk through why that behavior might not be okay, and then again, what to do about it. The last thing I'll say is that we did hear from some young people that sometimes, while the label doesn't change anything else that I've just kind of talked through, that sometimes it can be helpful in naming what's happened. And so the young people we talked to kind of said that is probably very different from person to person. And so along the way in that conversation, it may be worthwhile to say, you know, sometimes this behavior is called revenge porn, and sometimes just being able to name it can be helpful. So a couple different approaches there depending on the situation.
Yeah, no, I appreciate that. And especially, you know, just, you know, brings to the forefront the challenging with measuring something and the way that questions are asked in order to capture these youth's, you know, experiences, and also the challenge of not everyone necessarily recognizing that either the behavior that they've experienced or that they've done themselves isn't the healthiest or the safest, you know, kind of approach. There is another question that I think this kind of lends itself to, also because I heard you say something about, you know, like some of the safety precautions that they can take in terms of like the platforms and things. You all also mentioned in the presentation that technology is constantly changing, right? And social media is constantly changing. So do any of you, you know, have advice for how folks can stay, you know, connected and in the loop about these things? Because, you know, I think that can be a challenge for some people. I know TikTok and Instagram, but I don't know the ins and outs of how it works. So how can I support a young person? And by the time I learn that, who's to say that it's not defunct and there's a new platform on the way? So any advice I think there might be helpful.
You know, I think my advice is going to be maybe a little broader, but I think this is a really good opportunity to model learning and learning together when we don't know the answer. So, you know, when I talk with teens and younger adolescents in my life outside of my professional setting, and they're telling me about new social media they're on, I often have no idea what they're talking about. And I think it can go a long way to say, oh, I'm not familiar with that. Why don't we look through the privacy settings together? Can you show me or tell me about that new platform? And then maybe do a little research and come back to the conversation. But with technology, I think it is often the case that we're never going to be able to know all the pieces going into conversations, but can be a really powerful time to learn together.
I appreciate that. Thank you. Like you said, I feel like I'm always just one step behind in any of it. And I'm, yeah, always looking for personally someone to help me with anything, you know, not just social media apps. So we've got some questions coming in. One, does Activate have materials available in Spanish? Any resources available in Spanish?
This is a great question and certainly an area for growth for Activate. I don't believe we currently offer any of our resources in Spanish, but we will definitely take that back to the team and see if that's something we can add in.
And then another question coming through about what are the current numbers for kids involved in cyberbullying in the various areas? So is there kind of a breakdown? I know you kind of started to talk about some of the statistics in the data there, but maybe we can go back to that and highlight what's the most common or least common.
Sure. So we do have information on prevalence of the different behaviors when it was available in the research synthesis. So I would direct folks to that resource to look at. The tricky thing is that the data isn't tracked on any kind of national broad scale. And so we're really relying on community-based samples and smaller studies to try to make some generalizations about what might be happening. And so there's a bit of nuance. I wish I could say, bullet list of exactly what percentage of young people are experiencing it, but unfortunately the research just isn't there yet. But the research synthesis does provide some really helpful kind of understanding of which are kind of more common or and kind of the different ways that they show up for young people. So I would direct folks to that resource.
Thank you. So maybe that's something we can make sure that we link. And, I agree, there's the beauty and the downfall of research. And I'm sure if we all had our way and we could ask everything that we wanted and capture it just the way we wanted, the world would be a better place. But another question coming in, and also a shout out. So Carrie said, a shout out to the presenters for the intentionality around recognizing the diversity of relationships and how to be inclusive as we talk with you. So thank you for that. Also, curious, did the youth say that they relate to the term sexual cyberbullying? So I know we kind of talked about that, but is there anything else you want to add to that language?
I would say no. That is definitely language that shows up in research, and that because we need to call it something when we're talking about it and define it for folks, we labeled it sexual cyberbullying. But one of our youth supporting professionals that we worked really closely with on this resource, I remember one of our early conversations, he laughed and said, I would never take sexual cyberbullying as a term and try to talk about a room full of young people. I would be like laughed out of there. So what we did realize when talking with young people is by and large, there wasn't one term that resonated with them. And that, like I said, it often wasn't even really, it was more about the behaviors and feeling or knowing it was off, but not knowing why. And so I think the language can be helpful for learning, but yeah, probably isn't going to translate directly into practice.
It's hard when, there's the research conceptualization or definition or, whatever label of something. And then, like you said, you go out and they're like, no, that's not it. But like you said, you're still able to capture it through their feelings and their recognition of these behaviors that make them uncomfortable or just they see as unhealthy. So I'm gonna leave it for just one more second because we do have probably 90 seconds left to see if there's any last minute question that comes in, but I think it's gonna be really great once all of the resources are available. Like I said, we will have the webinar. And again, I wanna take a moment to thank you all for being here, for answering the questions, and for doing this really important and informative work on youth experience so that, like you said, we can translate and use this research to better serve them moving forward. Is there anything else that y'all would like to say before I send our closing message from the Dibble Institute?
Yes, thank you so much for having us and for everyone for attending.
Okay, so I just want to thank everybody too for joining us today. There is going to be a brief survey at the end of the webinar. It should not take you too long, and we would really appreciate you taking a moment to provide us some feedback by completing the survey. As I mentioned, the webinar will be available in a couple of days, about 3 days. A link will be mailed out as well as any resources, and you will have access to the PowerPoints for today's presentation. If you have questions, you can email us at relationshipskills@dibbleinstitute.org. And we hope that you join us for our next webinar that will be held February 12th, especially that third of you that was new. We hope to see you again. It will be social media, a healthy relationship service strategy. So we look forward to seeing you all next time. And thank you all again for your time and presentation today. So have a great Wednesday, everybody. Bye.